Hey parents, Angelique here. I wanted to post a video with quick tips for how to transition from 2 naps a day to 1 nap a day. It's a question that I get quite a bit, and I thought it'd be helpful given that there's a time change. Sometimes babies try to drop naps around the same time as the time change. So there are 2 developmental stages around the first birthday that can start the timeline for dropping naps. And very often for babies, they don't drop those naps until they're closer to 14 to 18 months. But up to 5% of toddlers, babies or toddlers, are down to 1 nap a day by their first birthday. 5% is a real small amount. So for most toddlers, they won't drop their nap. They won't go down to 1 nap a day until sometime between 14 to 18 months. The key sign that your toddler is transitioning to 1 nap a day would be that they start to take a short morning nap. A short morning nap would be 20 to 30 minutes, or it takes them 30 to 60 minutes to fall asleep for that nap. Usually it's the morning nap, but it could be the afternoon nap. If you've seen that for most days of the week, like 4 or 5 days of the week, it's a sign that your little one is going down to 1 nap a day. And you can start the transition by pushing the start of their morning nap to 15 minutes later every 1 to 2 days. So 15 minutes later every 1 to 2 days, start the morning nap. And then sometime over the course of 2 weeks or so, they'll be down to 1 nap a day, and that start of the nap is sometime between 12:30 and 1:30 p.m. That's quick tips for going from 2 naps to 1 nap a day. Thanks so much. Hi parents, Angelique Millette here with a sleep tips video. Today's topic is the 18 to 22 month developmental milestone. I wanted to talk about this today because it happens to be the second most common time for parents to reach out to me and enlist my help. The reason is that it's such a serious sleep regression that toddlers go through that they may go from sleeping very well at night to frankly not being able to sleep at all. They may have bedtime settling issues, waking up in the middle of the night for several hours, or early morning waking. Some of them stop napping. So the period of time from 18 to 22 months is a period of language acquisition, which basically means that your toddler is going to be talking a lot or trying to talk a lot, and they may be gaining up to 10 new words per day. It's an explosion of vocabulary, which is really cool, really fun. They'll understand a lot more than they ever have. They'll be trying out words, but it makes it really difficult for them to sleep because all they want to do is talk and practice talking. So the period of time when they are supposed to be sleeping is this time for integrating all these new words, cataloging them to the library, like I like to say. And so instead of sleeping, they just stay up in the middle of the night and talk. It's like their brains are on espresso, and they're firing and wiring all this new information, and they just simply can't sleep. So during that period of time, they may become more clingy. For some toddlers, they stop sleeping for a few nights or maybe a week. And then for other toddlers, they'll stop sleeping for sometimes several weeks. I've even seen a handful of toddlers stop sleeping for 4 to 8 weeks. So it's a mighty big regression that they have around sleep. It's a normal regression, but it is a big regression, and as a result, they have a very difficult time sleeping. And sometimes the only method that works is a parent presence method. Sleep training methods tend to not work very well because of the clinginess. So keep that in mind and know that it's a normal regression. Things do get back on track, and for some toddlers, you will have to introduce a parent presence method to help their sleep get back on track again. Thanks so much. This concludes the quick tips for the 18 to 22 month sleep regression. This is Angelique Millette posting a quick tips sleep video. I'm going to be talking about sleep regressions, specifically sleep regressions that happen with travel or illness or say with teething. So the first thing that you want to do is you want to just pay attention to your baby or your child's pattern of sleeping. Usually with the sleep regression, they'll start to wake up every 1 to 2 hours at night, or they might be up for 1 or 2 hours straight in the middle of the night. With illness, they'll be uncomfortable, they can't breathe, they might have a fever, they'll need you to console and comfort them. And then with travel, they may just feel a little clingy, or they might just sleep more unsettled, especially if they're a bit more sensitive. And then with teething or illness, you might see a pattern of waking every 1 or 2 hours at night. They may be able to get themselves back to sleep, but again, it's this kind of waking up and moaning and crying and calling out, and then they put themselves back to sleep. And then at some point, they may not be able to put themselves back to sleep at night. They're just really inconsolable and they need your attention and help. So you want to just adjust and follow your intuition. Be more responsive if your baby needs you, especially on a trip where they might be more clingy, or with a developmental milestone, they might be more clingy, or if they're not feeling well. The same rules apply. Just follow your intuition. Sleep regressions are fixable. Always remember that. Obviously, you're going to get less sleep. They're going to get less sleep during the regression. And if you pile up regressions, like let's say you pile up, I call it the perfect storm. Like let's say there's illness, travel, and like a movement milestone like walking. All three of those at the same time could potentially regress sleep for a couple weeks, even a month. So that means that there's going to be a little adjustment, a little bit less sleeping, and then as soon as the window of opportunity presents itself, and that means where you have a pattern or schedule where there's not much going on for a couple weeks, and your baby's illness symptoms or teething symptoms have really, they've passed or they've lessened, that's your window of opportunity. And at that point, you can start to do a sleep method again. Any one of the sleep methods that I use in the Millette method, the no low cry, parent presence methods, or sleep training methods, any one of those will work at that point. But you want to first follow your intuition, and then once things have gotten a little bit better, your child may still have developed a habit of needing you a lot more at night, but that would be the time to start a sleep method at that point. All right, that wraps up handling sleep regressions. It's a quick tips video. If you'd like more information, I have an hour-long webinar. It's on my website, angeliquemillette.com, and the webinar covers multiple ways of implementing methods. It includes all my handouts and guidelines for those methods. Thanks so much. Hi, this is Angelique Millette, and I'm here to share with you a little bit of information about night terrors. I get a lot of inquiries from parents about the difference between night terrors and nightmares, and I wanted to just describe a little bit about night terrors so that parents can better understand the differences. With the night terror, they occur usually between 10 p.m. and midnight. And that's probably the single greatest reason that makes it a little bit different than, say, a nightmare. A nightmare could occur any time of the night, mostly in the middle of the night or early morning is when you would see a nightmare. So night terror happens usually in the 3 to 4 hours right after bedtime. You'll know that it's a night terror because your child probably won't respond positively or respond at all to your trying to comfort them or soothe them. The definition of a night terror is that your toddler or young child gets stuck in between sleep cycles. They're going from a deeper sleep cycle to a lighter sleep cycle. So as they're basically traveling up, they get stuck in between those sleep cycles, and as they get stuck, they're kind of like, they're still sleeping. They might even have their eyes open. They'll be very active. They could be screaming, yelling, flailing, kicking. It actually can look like quite scary, like they're almost possessed. I've had some parents describe it like that. But in fact, what's happened is that they're stuck in between sleep cycles. There's nothing you can do. They usually pass within 5 to 10 minutes, and then they will continue to sleep. So the very best advice I can give you is to try to keep yourself safe and keep your child safe, because the old advice for putting them in the shower, turning on the lights, it really doesn't make any difference, and it can actually contribute to an injury in yourself or your child. So keep them safe. They will pass through the night terror. And we only see night terrors in about 3% of kids. It has there's a genetic basis in it, so there's a family history in night terrors. And you can rest assured that by the time your child is anywhere from 3 to 6 years old, they start to mature out of having these night terrors. So a little bit of information about night terrors. Thanks so much. Hey, this is Angelique Millette, a pediatric sleep consultant and parent educator, and I'm going to talk a little bit about toddler sleep regressions. It's really a big topic. I could spend hours and hours talking about it, but I think what I want to focus today's quick tip sleep video on is just some of the highlights of toddler sleep regressions, because I think that it can help to kind of put things into perspective for parents.
So one of the challenges that your toddler is going through is that they're becoming a little independent little person. And that's great news. That's exactly what you're after, is that they're really trying to express themselves and verbalize their needs. They are trying to put into words their emotions, their feelings. All of that is really happening in a big way starting around 18 to 22 months, and then it really just continues and continues and continues. So one of the reasons that your toddler's sleep will regress is that they will become they start to have a greater imagination. Fear of the dark starts to develop around age 2. Impulse control starts to develop around age 2.5, and these are proximate times. So you have this fear of the dark that starts around age 2. Impulse control, which means that they could respond to rewards or consequences. They could be coaxed to stay in bed or put themselves to sleep with your encouragement. That starts around age 2.5, 3. The other thing that's really happening around age 2 is that their imagination is just skyrocketing. It's really going through the roof, which is great. What you start to see is this development of a lot of pretend play where you'll see them kind of putter about their toys, and they'll tell stories about the experiences that they had at the park, maybe at a daycare or preschool program, maybe with a younger sibling. They start to put that into imaginative play, and as they're playing, they work out feelings, emotions, their issues. It's a great thing that your toddler is doing that. The more that they can do that, the easier it is for them to actually sleep at night. So encourage that pretend play. You can't really discourage it. That's what they want to do anyway. But it does mean that as their imagination and creativity starts to increase, that they may develop fears and phobias, and you would start to see the development of these nightmares. Common topics that I see in a child's nightmare would be spiders, monsters, dinosaurs, whales, something big that might be coming after your child. Those are all very normal, healthy kinds of topics or nightmares for your child to have, but it would wake them up at night, and they may have a fear of going back to sleep. So you could see that there's this rich interplay happening in your child's sense of themselves, their emotional makeup, their imagination, and all that plays a part in sleep regressions. And they're frankly becoming some normal kinds of insecurity and clinginess where they just really need you a lot more. So I just want to put that into context so that parents can really understand that when it appears that their child is maybe being naughty or not paying attention at bedtime or really pushing the limits, in fact, this rich tapestry of development and your child's budding independence and imagination, all that is playing a part in their ability to feel safe and secure and put themselves to sleep at bedtime, and then feel safe and secure to put themselves back to sleep in the middle of the night. It really helps us better understand why they would get out of bed at night and look for you, why they would get out or wake up at night and call for you. All of that is a normal part of a child who's feeling a little bit more insecure and clingy due to all these big changes that they're going through. So I hope that's helpful for you. It's been great to share that information with you. And then you can look on my website to find out a little bit more about how to use the chair mattress method. It's under the topic Toddler Sleep Regressions in the archive webinars, and it talks all about how to help a toddler who's getting out of bed at night, how to help them stay in their bed at night without making them feel more clingy and insecure and anxious. Thanks so much. Hey, this is Angelique Millette, a pediatric sleep consultant and parent educator, and I'm going to talk about the transition from the crib to a toddler bed or a child's bed. So typically that transition happens between the time your child is aged maybe 2 to 3. Impulse control develops around the time your child is 2.5. Some children are already developing it before 2.5, but for most it happens after 2.5 to age 3 and then on. And you'll know that they're starting to develop impulse control because they'll be able to respond to rewards and consequences, and you'll just start to see that there's some delay in gratification, that they'll be able to sort of delay their needs for a sort of a result or a reward. So if you have to make the transition out of the crib, earlier than say 2.5, 3, and that can happen because you have a toddler who's climbing out of the crib, which could happen between the 18 to 22-month developmental milestone. It's a particularly big time for language acquisition. They're getting up to 10 new words per day, and as that's happening, they just become more clingy. They may want to climb out of the crib. So if you're finding that you're kind of having to make this transition out of the crib sooner than you would like to, you have a few options. The first option is simply using the conversion crib. And a conversion crib is when you remove one side of the crib. Usually there's a piece that as you remove the side of the crib, you replace it with it's like a half, it almost looks like a half crib side. It's almost like a little gate, but there's a little hole to it. And that's a conversion crib, and that would permit your child to be able to get out of the toddler bed if they needed to at night, which once they start to do some potty learning, they're going to need to do that. If you have to use the conversion style crib, if that's the setup arrangement that you have, basically what you do is from one night to the next, you just remove the side, you put on the conversion side, and then you basically start bedtime routine as you normally would. Now for most toddlers, they are actually going to stay in bed, which sounds surprising, but for some reason they find that the side rail is a limit and they'll stay there. But for some toddlers, they just won't. They just don't have the impulse control. They're just really excited by that freedom and that space, and they will get out of their beds at night, and you'll find them wandering the hallways. You might find them in your room or in your bed. And for those parents that want to help their children to sleep in their beds for the whole night, you can use a method like the chair mattress method to help them stay in their beds for the whole night. I won't be able to go into too many details about that method, but I do have that method on my website under the webinar, the archived webinars. If you look under the topic Toddler Sleep Regressions, I discuss the chair mattress method and how to use it specifically for a child who's getting out of their bed at night. If you don't use the conversion crib, the other option that you have is to set up a mattress in your child's room. And I like the mattress option because you can sit on the mattress with your child, and maybe the week before you actually move them out of the crib, you can do the bedtime routine on the mattress, do some snuggles there in the evening. But after you finish the bedtime routine, put them down in their crib at night, so they're still sleeping in their crib. Do that for about a week. So they're starting to get used to getting their needs met and having some snuggle time with you on their bed. They're not quite sleeping there yet, but then after about a week of having that snuggle and that bonding routine at bedtime, then get rid of the crib and then just have them sleep exclusively in their new bed. And again, the same rule applies there with the new beds. Some toddlers will just stay on their new mattress. They won't really get out of bed. Others won't be able to. They just get very excited by the new space. They get out of bed at night. You can think about putting up a baby gate, but I would recommend that you take a look at the toddler sleep regression webinar on my website to learn more about this chair mattress method. It's a great method if you do have a little one who's getting out of bed at night. Thanks so much. That wraps up this quick tips video.